It's very clear now that VEGF signaling and angiogenesis is a critical factor for tumor growth. The recruitment of blood vessels and the development of new blood vessels within the tumor microenvironment and the vasculature, this feeds the tumor to grow. So there's a lot of scientific rationale to targeting this process to limit tumor growth. So bevacizumab is an antibody that targets the ligand VEGF, and ramucirumab is an antibody that targets the actual receptor, the VEGF2 receptor. So they have a little bit different mechanism of action there. Both work to halt the recruitment of blood vessels and VEGF signaling. I think it's important, if you're going to use bevacizumab up front for a patient who's treatment naive, you're going to use carboplatin paclitaxel bevacizumab or carboplatin pemetrexed bevacizumab, there's still a role for ramucirumab second line. You haven't burned the bridge for ramucirumab. And in fact, in the data, the REVEL data, for those patients that actually got bevacizumab first, there was still an overall survival advantage by adding ramucirumab second line. So if you use bevacizumab, I've had a lot of second opinions say, well, I've used Bev already, can I use ramucirumab second line? The answer is yes, you can, and there is a benefit. But these drugs work a little differently. But both have shown survival advantages in specific lung cancer patient populations. Yeah, I think this is also underrepresented in at least there's a lack of awareness. Patients who had, squamous cell patients, unlike bevacizumab in the ECOG 4599, squamous cell patients weren't allowed. In the REVEL trial, second line, squamous patients were allowed. And in this trial, A, ramucirumab was safe, and B, there's still maintained that there was a benefit in overall survival by giving ramucirumab in squamous cell patients. So for a squamous cell patient in which they're on chemotherapy frontline and they're progressing, and immunotherapy is not an option for them, and immunotherapy is an option for a lot of second line patients, a lot of squamous cell patients with second line, don't get me wrong. But if they're not, then docetaxel with ramucirumab is a reasonable option for these patients. I think in the second line, a lot of the times we are trying to elicit better responses. Better responses theoretically can lead to better improvement in symptoms and quality of life. So for these patients that are second line in which I'm thinking about trying to elicit the best response I can, I know at least based on the REVEL data that the addition of ramucirumab did lead to an improvement in response rates. So it's a consideration. It's certainly a consideration for a patient who's fit, who's symptomatic, who's progressing on chemotherapy, who's not an immunotherapy candidate or has a PD-L1 that's very low and is rapidly progressing, or has a specific genotype that immunotherapy would not be used, ramucirumab is a consideration.